Okay, everybody, good afternoon and welcome to our panel discussion today. My name again is Pam Notemeyer-Rogers. I am the Vice President of Client Services and Partnerships with FA Solutions. We are thrilled that you could join us this afternoon to spend about an hour as we talk to some of our esteemed panelists today. We have two of our clients with us, and we're happy that they are both here. Dr. Wagner from Northeastern Technical College, and then we also have Dr. Eric Lamott from Concordia University. To kind of present a little bit what we're going to be talking about today is 2020 did present a lot of challenges with how we can run campuses remotely. Some of our school partners and many of you may have been already able to do this, but for some campuses and for some of our partners especially, this was a big challenge for how they were able to not only keep staff engaged, but also to keep their operations moving forward. So today we have two different parts of the country that are going to be speaking to us about some of the challenges they faced in leadership, as well as moving online. And now as we start to return to campus, what's that going to look like for each of their respective institutions? You know, the remote situation was very difficult for some, and for others it was easy. So again, it'll be good to hear from these two panelists exactly how they were able to maneuver. And then we have Bridget McGuire, who's our Vice President of Operations, and she's going to talk a little bit about the CARES money that's come in and how we were able to help our school partners manage spending that money and making sure it was allocated properly. So without further ado, let's get started. So with Dr. Lamott and Dr. Wagner, again, thank you very much for joining us. We're thrilled to have you. You know, Dr. Lamott's up in Minnesota, where it's, you know, a much different setting than, you know, we have a rural situation in South Carolina in a school that's, you know, definitely in a different demographic as well. So it'll be interesting to see how both of these gentlemen answer the questions that I have for them today. So I'll start with you, Eric, if you wouldn't mind. Can we talk a little bit about how you had to adjust your leadership style at Concordia? Obviously, you're the EVP of operations, and you also have some academic leadership and oversight as well as finances. So you had quite a big job in terms of, you know, helping the president position the college. So can you talk a little bit about some of the things you had to do immediately to be able to get yourselves where you needed to be?
Sure. Well, and maybe just a little context too. As you said, we're up in Minnesota. Concordia is about 5,500 students, and a third are what we call traditional age students, a third are in the adult segment, and a third are in our graduate segment. So actually had different challenges within each of those segments. Odd note there is most people think only about the trad students, but the adult students were the ones that we've observed had probably even the greatest impact on their ability to persist. So for us, getting to the point, you know, first and foremost was we started like most. It is a crisis response team componentry of collecting the information as we knew it at the time, understanding what the governor's responses or expectations were of us to move to the online format, and then our ability to move that way. So it set a number of processes in place as we tried to think about, how do we transition to meet our learners' objectives? We always kept that as our forefront in all of our decision making, is what is going to be the best interest of that student, and particularly in the trad population, which we're talking about today. They want to be in face-to-face environments as soon as they possibly can be. And so that was our thinking all the way through the summer. So setting that up using this crisis response modality, moving into a COVID response team after the initial transition occurred, and then starting to set that process for how do we start to re-engineer bringing our students back to campus, which we actually started in June and had students back on traditional campus by fall in a hybrid model. But that communication piece was big. And then the other thing that's unique, probably more so to us than it was the rest of the country, although it impacted the rest of the country and often the world, was, you know, Michael Floyd, the death of Michael Floyd actually happened in our backyard. And the civil unrest was a block away from our campus. So we had kind of multiple crises and challenges at multiple fronts happening. So having communication vehicles out to all of our constituents as well as operationally added some additional challenges.
That's a very good point. actually, because as your partner, we know we've worked through both of those things with you. So yes, you did have multiple things you were dealing with.
Pam, I think you got quiet again. If you want to repeat your question.
No, actually, I was just going to say that that is something to consider based on your location as well, up in Minnesota. Dr. Wagner, how about you? Your situation and location is very different than Minnesota, so maybe you can give us a little bit of a landscape. And I know the challenges you face, but I'm sure the folks on the call would be love to hear how you overcame those.
Well, thank you. Yes, we're very rural. We have 4 campuses throughout an area of about 100,000 residents in 3 counties. And we were fortunate or unfortunate, it depends on which eye you look through, but we just came through a hurricane season where we were shut down for a couple weeks. And through that experience, we said, we're not doing this again. We're going to come up with a complete, kind of like what Eric said, a crisis reaction. How are we going to not shut down and still serve our students if another hurricane comes through? Well, because of that, we had this thought process going on, and we'd been working through different models. And then whenever COVID hit, it was a little bit different because I'm a very hands-on guy. We like to have meetings, and we had to move to Zoom, and we had to move to Teams, and we had to get that spooled up. And even in the hurricane situation, our workforce had never really shut down and stopped doing face-to-face. But in the COVID situation, we had to. So my general education faculty really came together with my workforce faculty to get them spooled up on how to do distance learning, how to do online learning, how to get their lessons moved over to online. And it became a real collaborative operation, which is one of the times that general education and workforce work together to accomplish a project. And so and then we went into leadership, sometimes we met 5 times a week by Zoom. We were shut down for 5 days, and we gave ourselves 5 days to convert over to a full online, and then we re-spooled back up. And through that, we immediately started doing analysis about our rural community, and knowing transportation is an issue. And that's why we have 4 campuses. We had to think of now, how are we going to get the students, the classes? And we immediately reached out to our internet providers. And through our internet providers, we set up a system where we now pay for the internet of our students in their homes. And through that process, we learned everywhere in the community that they did not have internet in their homes, and we turned that over, and that's been a big driving force in South Carolina to determine who will be the priorities to get internet into their communities and the cost to take that into those communities. And for students that didn't have internet in their home, we did partnerships with AT&T, and I have to give a shout out to Post Communication. They provided our internet for our Chesterfield and Marlboro students. And Spectrum came to the table with quite a few offerings and different ways to do it for our Dillon students. And then AT&T came to the table with a whole ability to do hotspots, because we found also that there's not towers in the area. So how could we create our campuses to become areas that they could come to and take their classes and then go back home? And the importance of the remote campuses, reaching out to churches and throughout the community to set up local areas for students to take classes. And those are the real things that we tried to do right off the bat to make things work.
That's incredible. Again, we have at FA Solutions, we have a bird's eye view into your operations. You're clients of ours, and we work with you weekly, in some cases daily, considering what you were going through at the very beginning. So for you to be able to get that turned on for your students was nothing short of a miracle, frankly, of coordinating all of those resources for them. And I know that you've actually had enrollment growth as a result of what you were able to accomplish during a pandemic. And Eric, you the same. I think both of your schools, frankly, and are similar in the fact that you were able to make these adjustments and not lose, footing, if you will. In terms of some of the other projects that you are running on your campuses, what are some other things that came out as almost unexpected productivity, if you will, from the pandemic? What were some things that actually got fast-tracked that were stuck?
Yeah, I'll start, and then
Yeah.
President Wagner can jump in. I mean, one of the things
Great.
that was unexpected for us is, well, okay, so the campus is essentially closed down. Only essential workers can come in. Well, our facilities people actually could come in. So we actually did deep dive work in our residence halls that you really have a hard time getting after if you're renting them out in summers and so forth. We did more capital improvement, up front projects than we thought we ever possible. So unintended consequences, and that of course centered around that student experience. I think, Pam, that's the key thing. I think if you look at the schools that were really, how do you center this around the student needs and experiences so they can persist to their degree or credential as uninterrupted as possible. So pieces of doing that, technological upgrades, and just like with President Wagner, the outside partners that have stepped to the table to help things go seamlessly. And I think Financial Aid Solutions is a good example of that. We could stay connected with our students, the IT providers out there, as well as we too had to spin up depth of bandwidth as well as those CRM spaces. So some nice things that happen out there. Actually, even one of the things I was just talking to my student life person is we're talking about the return of students, like even returning this fall again, is the method we used for starting this last fall, we're actually going to use even going forward. So some of those systems made us stop and rethink, why are we doing it that way? You know, this is time to rethink and restart and do things differently, and even space utilization to start thinking differently about how that might be used.
Yeah, I'd say facilities is one thing we've really been able to tackle too. Is we've taken advantage of the students not being on campus or limited on campus to do some facility upgrades that we've been needing to do for a long time. The other thing that we did was we found out that most of our students were using our computers in our computer labs. So we had to now get computers to the students. So we went on a huge buying campaign to buy laptops so they could take them home and get on the internet. The other thing, because the campus was closed, they couldn't buy books. So it became a big push now to move the college over to an OER, and we're 87% OER. 87% of our courses now are OER resources. So students now have to have a laptop, and moving forward, we see the internet staying for the students, that we will continue to pay the internet for the students because of the transitions we've done during COVID, that we want to continue with the efficiencies. The average student, when we moved over to OER, is saving $900 a year in book cost. And so that's huge for the student. A couple other things that we did was we rolled out several campaigns that really focused on the student-centered model. We created a dashboard where it was a central location for communication. So students could go to a central location on our website and get the latest information of what the college was doing and what they needed to do to stay engaged with the college. We started this campaign called Believe in Yourself, We Believe in You. And it was a BU campaign, and we really pushed the Be Strong, Be Bold campaign. It was very successful in the community, really built confidence in the students. We also did another kind of a unique thing, is we took some of our CARES money and we partnered with local farmers markets, and we purchased food. And we did food distribution for the students that were currently enrolled. So all the students had to do is bring their current ID and drive through, and we had a drive-through set up, and we would give them a food basket from the local farmers. So that was very supportive to our local entrepreneurs, and it helped our students during the crisis. One other thing that we did do was, because we also received a PPP loan, and so because we did that, the experience we went through, the state asked us to put out a webinar on how small business could access the PPE loan. So we did several, we actually ended up developing several webinars to help people connect to resources in the community to help them through the COVID crisis. So we did a lot of things for our students, but at the same time, we tried to look at how we could help our community and how we could benefit the community and keep the students engaged in the community and engaged at the college at the same time.
That's fantastic. I knew about the farmers market. I thought that was pretty unique. Eric, were you guys able to do anything unique for your community that you wouldn't have thought of doing? Did you have a similar situation?
Well, we had similar pieces where our food bank, it wasn't with the, so we had food shelves and so forth. We also had a large number of our athletic teams would do rallies to collect material and or distribute too. So they work with local churches, and we go out and help facilitate the movement of those pieces as well. So it really is interesting how it really brought out the best of a lot of people in unique and creative ways to help and support each other during moments of crisis when oftentimes people wouldn't consider that. And so I think that that's a good use of the PPE money and the creative COVID funds there too.
I think, you hear about the bad stuff, right? Let's face it, but there's so many good things that happen in these smaller communities and within the college communities, especially because, again, people have such a sense of belonging. So I think there's, a lot of positives that came out of COVID, despite all of the disruptions with everyone's lives, frankly. I think I want to shift gears just a little bit and talk about your staff, because obviously as managers and as leaders of your community, your institutions, we are a remote company, FA Solutions is, so we've been working in a remote environment for as long as we've been in business, right? So we get that. But for schools that are used to doing face-to-face meetings, that are used to having conversations with employees, used to walking down the hall and seeing each other, I think one of the biggest challenges for at least a lot of our partners was, how do you lead during this time? How do you actually lead an executive team meeting, when you're used to sitting around a board table? So, maybe talk to me a little bit about, some of the ways in which you were able to keep initiatives moving and, because people obviously got into COVID mode, even in their own homes, right? So how do you keep people engaged?
I'll take a shot at that. I think part of it goes back to the crisis response philosophy, where you start with a small team and you work with communication teams beneath that extend the information out to individuals. First and foremost was just the HR practice, right? Of how do you take hourly people, move them in online, ensure they're working. There's some of that legality piece that had to get worked out, and some of our HR team were able to think that through with a degree of flexibility. But then also, how do we set the expectations that we need our staff and faculty to be working on these problems, right? And so even amidst the challenges of their daily lives with kids at home and all those kinds of things, to be able to set aside block times where we can make sure that we had windows of time to work. So 10 to 2 is meant to be preserve that time so that you could be doing CSP work, recognizing people's lives and challenges rolled into that. Certainly making sure everybody had the tools and technology and ability. And fortunately for us, we're a laptop campus, were for a long time, so that's ingrained in our system and our employees all have those. But not everybody had the ability to connect in at the thresholds they needed to, so supporting that. So that infrastructure was following that crisis response process of the communication, and then have work teams that are reporting back up to the groups and then working down on solving problems. The goal is, what's the problem? How do we solve for it? We use kind of that SEAL team mentality of everybody has a role and responsibility, but inside of that, we need each of you to solve that with your teams, and then bring that solution back to the table so we can work the problem and advance to the next problem that we just have to solve for. But that communication with the team, and we communicated, like most, very regularly, both to the employees with specific messages there, as well as to to our rank and file students.
Yeah, we did very similar. One of the things that we did was we looked at our faculty and staff and everyone working at the college, and we wanted to make sure everyone could stay employed during the crisis, even when we had to work remotely. So we created teams and we had meetings. So we had enrollment teams, we had student success teams, we had multiple teams set up, and people that had never done that had now got signed to that team to participate. And it really became a way for people to learn about other parts of the college. And they were bringing different things to the table that the people that normally work those issues hadn't seen. So it really made us better, because we got more perspective and we had more people working issues. It really improved our processes and our procedures. Our enrollment process now is so smooth, and we created a whole touch point place. When a student doesn't log into a course to take their course, we have a team now that comes in and contacts those students personally and finds out what's going on. And that's all developed from COVID. And just to give you an idea, bringing multiple people onto the team and from untraditional areas to look at enrollment and persistence and retention and all those things. Just to give you an idea, spring 2020, our enrollment was up 13% from the spring before. In the summer semester, our enrollment was up 27% over the summer before. So tremendous retention efforts, tremendous enrollment efforts. Started, a lot of my CE people started coming with different ideas to react to, look at groups of students that we'd never looked at before as potential students, to get them ready for post-COVID. Because one of the first things we started thinking of is, once we got over the first week of shock and how we were going to adjust the college and spend the next 2 or 3 weeks proofing it out and making it happen, then we went into the mode of post-COVID. What's the college going to look like post-COVID? What are we going to do to open the economy back up in our local community? And then a lot of the things that we did from a leadership standpoint was look at how we could, and through these team meetings, identify things in the community that we could do to start bringing normalcy back, to help employers find employees. We did, in the middle of July, we hosted a hiring event. This was last summer. We hosted a hiring event where we sent out advertising commercials and had the people that were going to participate in the event pre-enroll for the event. So they did it all online. We did Zoom sessions to get them ready for it. And then we screened the applicants and then helped them develop their resumes to tailor to companies that we knew were going to be there, that we could refer them to the interview process. And then those companies came in and hired. We had over 300 people participate, and over 50% were hired on the spot. So it was tremendously successful to help companies re-spool back up and have employees. And that came from these team meetings we were having. And a lot of that came from non-traditional people that had not participated in them in our traditional setting. And now they were participating in these sessions to learn more and bring more things to the table for ways we could react.
You know, I think you bring up a good point too, because at the end of the day, after the initial shock piece, it's all, you still got to keep running the higher education operation, right? So adding new program, we still add, you know, how do you go out and find new programs, you know, generate those pieces, and the focus stayed on that learner, right? What is their need? That is our core business. And so how do we make sure that we're adapting to their needs? Well, that's one phase of this, safely. And then what are the ways that you adapt to the new programs and new opportunities that are currently presenting themselves, and as you're saying, President Wagner, that are going to be coming forward very soon in this new post-COVID world that we're in. And that's the same place we were spinning up. There's a program that we picked up in Portland, Oregon at the same time. So we were adding a new cadre in a whole different state during the middle of the summer amidst all the other things. But that helps people stay focused too, gives them something to do, something that's actionable. And I think that helps also as well, rather than having people being disconnected from something to do that's meaningful and tied to the core operation of the learners of the institution.
Well, one of my goals was to keep them motivated and keep them looking that this is going to end, and we have to be ready for when it ends, and that there is the sun, and the sun will rise again, and we need to be ready when the sun comes up. And so a lot of the things that we were doing after the first initial shock of figuring out what we were going to do and getting that up and going then was the post-COVID. How are we going to recover our local economy? And not to brag that we did this, but our local economy, we're leading the state in unemployment as the lowest unemployment. And this is an area that in the last recession, we were the highest unemployment. So tremendous effort of keeping the community engaged with the opportunities that are in the community and the job openings in the community. And it took a lot of people to do that and a lot of communication, but we were part of that.
That brings, we actually do have a question, and I think it's probably one to definitely ask now, because the question has come up as, when do you have students, faculty, and staff, when you have them on campus, what protocols are you currently taking? That's the first part of the question. So how are you admitting students back on your campus? What are some of the things you're each doing? I mean, you have a residential community, Eric, so that's different. And then of course, Dr. Wagner with yours. So maybe you can go first, Eric.
Yeah, no, I mean, we had to work within the state guidelines. So the governor set some expectations as the summer started to move forward about when you could start doing things, and had to have certain parameters in place, social distancing. So like everybody, we tagged everywhere. We actually had an antimicrobial spray that was put on all surfaces. It has an amazing shelf life to it. We put in ionization systems in all the airflow systems, which also has long-term benefit for cleaning the air for COVID, flus, fungus, and all the rest of it that will be going on persisting. Obviously plexiglass and all the rest of those procedures, masking. We did videos for the students that are kind of targeted at the students so they can grasp the importance of it. And we've had great compliance. So we started moving back in May, June with small programs and activities. And we rotated faculty and staff in on a kind of a third basis. But by halfway through the summer and by fall, we had already, we're back in class sessions full tilt, following the guidance of the state, right? So we still had to have a plan. The plan was posted on the website. Everybody was brought up to speed about how that was going to go, how the whole systems came together. And we track it. We have COVID calls every day. I'm mixing it right now. We have forms that are filled out that students and faculty and staff would fill if they have the expectation. We have what's called COMETS commitment, that people adhere to the standards and stay home if you're sick, just like the flu and all those kinds of things. And we track that. Of course, now that testing became more widely available through the fall, and certainly now, we've got large amounts of testing going on simultaneously. So we get those reports every day, 3 times a day. And our IT people have this all automated now, so we can track and communicate with all the faculty that says, well, Pam was a close contact, and so it goes right to all of our faculty, and there's a scripted message to allow them to let Pam work during this period of isolation and so forth. And then, of course, built systems around our housing pieces too. So you had extra stock for people that could live in that space, and in food supply systems. So it's quite a lift, but that's been working. We actually currently have 0 active cases right now, and we've got the full traditional student population on campus and running, and athletics are competing, and so great work by all of our faculty and staff to really put this together. But really, in the end of the day, it's our students too. We're in a metropolitan area, so there's a lot of dynamic movement in and around, and people are doing a great job adhering to policies and procedures. We have one person who just walks around and wipes down the surfaces, so they try to get it. Over the summer, the guy lost 13 pounds, just by all the steps of walking through the campus. So lots of little layers of trying to put the physical elements, the cleaning systems in place, the tracking elements, and capturing that, and then coordinating this all within the state Minnesota Department of Health COVID response team too, so that we're part of the ecosystem of supporting the larger yield.
Yeah, we're very similar. One of the first things we did is, of course, Pam, you know me, everything's about branding. The first thing we did was we bought the students a PPE kits. And what we purchased them was a little packet. It was an emergency kit. And in that emergency kit, there was a mask branded to the college. There was lip balm, because your lips dry out when you wear your mask, branded to the college. There was their own personal hand sanitizer branded to the college in this kit. There was Band-Aids, first aid kit, things like that, all in this little packet. And when the students signed up remotely and participated in the Zoom sessions to learn about how to come back on campus, and we did a lot of Zoom sessions with the students about what to expect when they come on campus. We actually did a video about walking onto the campus, how you enter the campuses now. We set up designated parking lots for students and faculty to enter in different parts of the campus. And if they participated in that, we mailed them the PPE kit. So they got this PPE kit in the mail that had Northeastern Technical College on it. And the students loved that. As a matter of fact, it's the most requested item when we're around the town. I went to the bank the other day, and the bank wants me to bring them 20 masks because they think they're cool. But with that said, we also, at every campus, we have limited entry. We have an employee entry at the campuses, and we have a student entry at the campuses. And we have put in a screening system where you walk up, and it actually it doesn't take a picture of you, but it scans your face and it takes your temperature. And if you're not wearing a mask, it tells you to put your mask on. So, and that's at every one of our entry points. So anyone that enters the building has to be scanned. So even whenever we're doing community events, everyone has to scan. And if you have a temperature, you're not allowed to come in the facility, and you have to leave the facility. And so that's really allowed that. And just like Eric said, lots of social distancing, a lot of plexiglass barriers between even our CNC machines and our welding booths are pretty lucky because they're pretty isolated, but allowing that space for students to come in and work. So we're still not to set down classes. We have not went back to traditional lecture classes, but we still use the hybrid model where they log into either Zoom or Teams through their D2L shell and participate in live classes in an environment. We do have athletics. We have one athletic program here, and it's called esports. And believe it or not, esports is an online sport, but they come to our campus to participate because we have the best broadband and everything. And so believe it or not, our esports program comes to campus to compete because we have the resources to be able to do that. So just like Eric said, we have activities going on campus quite a bit.
And even in our experience, this is part of our regionality too. We have not had any transmission associated with the academic enterprise of the campuses or athletics for that matter. So it really it has shown that when you invest in those physical assets as well as those behavioral changes, you can do that. We also have these kits in the classroom so that they actually are clean between each session. And the individual student can choose to clean again if they want to, so that it's sanitized to the comfort level of all the participants. So lots of layers. Obviously, more we could go into depth here, but it's we try to document it all, get up on the website, and communicate that ongoing to people. We're at this challenge now. We're communicating all the time. Is how do you refresh that in people's minds now that we're well past that zone now? So probably more vaccination conversations now.
So you're shifting gears a little bit about, how you can get vaccinated when and where they are in the list and so forth. I mean, your populations are both very different in some regard because of the adult population and the, much more vulnerable at times with Dr. Wagner's area, but most definitely, shifting the conversation. It's now become part of your new strategic plan, right? So if you think about making your strategic plan, you had a disaster plan that you may not have really looked at or implemented. I know certainly when we look in the Southeast with, the hurricanes and the water and the flooding in your area, Dr. Wagner for sure. And, Eric with weather up in Minnesota, the winter weather is typical. So you're used to that, but this became a whole nother level of how do you plan for this, from a strategic, planning. And honestly, there's no reason why we can't continue to deliver education and continue the students' experience in a robust way, providing all things being equal, you can continue on as you've been going. And now the bonus is going to be that you can actually come back to campus, right? So now it used to be the luxury of staying home. Now it's going to be the luxury of coming back to campus in a safe way. So I think it's very different how things got turned upside down in very short order, I should say. Looks like we also, second part of that question was about the staff and faculty, and Eric, you definitely answered that as well. It sounds like you do a lot of contact tracing in terms of anybody that's had contact, and if a student reports, you do the same thing, I'm assuming, with contact tracing on both campuses. Is that accurate?
Correct. Yep, we work with our own local contact tracing and then coordinate with the state contact tracing and vice versa to make sure that we capture all the potential close contacts.
And I know Dr. Wagner, you as well, right?
Yes, after they go through the screening process, they actually sign in, and then that keeps a record that we upload to the state every day. And then if we have a reported case, and like Eric said, I don't think we've had any that was a transmission from being on the campus. We had no reported transitions on campus because of all the measures that he talked about, wiping down the classrooms, wiping down. We even did training videos on how the students wipe down the machines, and they watched those. And we made those available in their D2L shells for them to review. So having those protocols have really helped. And I'm knocking on wood because I don't want it to happen. So, but we've been very fortunate. But same thing, even if they report that they got exposed over the weekend or in a family gathering or something like that, then we do contact tracing and notify people that had been in contact with them prior to get tested. And we follow all state requirements for how long they have to be out and all that. And we do staggered days in critical areas like our business office and those areas where only half the people that work in the business office work any particular day, and the other half works from home. So half is in on Monday, the other half comes in on Tuesday, the other half comes in on Wednesday, and we rotate that around to make sure that if there is an exposure in the office, that it's limited and the whole department doesn't shut down. And we do that throughout the campus, and each director or manager of their area submitted a plan on how to keep their office open. and what their plan was to keep it open. Even if they have an outbreak in their office, they still have to be able to open that office. So they had to come up with their own plan on how they could manage their office, because it's their operation and they need to tell us how they were going to most efficiently be able to work in this environment to keep their office open to service the students.
Eric, there's a follow-up question that was directed to you regarding how you're able, it sounds like everyone back to campus, which is great. How are you able to really maintain the social distancing? And I think, some of the schools that might have joined us today don't have a campus. And again, you're in a metropolitan area. So, and Dr. Wagner's, his buildings are, spread out a little bit, but some of his campuses are pretty small and compact and, not very spacious. So maybe talk a quick minute about how you're able to maintain that.
Sure. Well, there's a couple of layers that happen. So there's the kind of global, the world is at 6-foot bubbles, and then there's the reality that you can actually be inside the 6-foot bubble if you have the right PPE involved. And so we have extra layers that are in those spaces, even in the classroom environment, where you can actually have people closer than 6 feet, but if they're both wearing masks, they're not in engaged activity, that they do become close contacts in the event that one person is considered a positive, then you would capture that. But within the guidance of the state, we're allowed to do that when we can't separate across the space. Most of the things we actually were able to disperse in the physical environment. We also did a hybrid model for the faculty. So roughly a third of the course was moved into the online format because we already had that going. But then labs and those kinds of things you need to do in the space, and you could do that. So PPE protection, seat assignments for contact tracing, so that we would then identify those individuals that were within that 6-foot radius potentially that would be considered close contact. And that's part of our whole tracking process, so that if there was a positive case, it was identified in any number of ways. We would then go back through the class periods. We would look at the time periods we'd identify any of those close contacts, put them out on close contact for that time period. But there are a lot of creative ways that folks worked to solve for that. And again, still no transference. And I give that back to the students, particularly that have done a really good job, because everybody's anxious that students wouldn't wear their masks and wouldn't engage in strong, healthy behaviors. But by and large, we've not had that problem whatsoever, and are blessed with the results of that.
How about you, Dr. Wagner? Is there anything you can add in terms of really maintaining that social distance on your campus?
Pam, I couldn't hear you, but I think
I'm sorry, maintaining the social distance on your campus as well.
Yes.
How were you able to do that? Any additional insights for the panel?
We have a warehouse full of furniture. We went into a lot of the classrooms and pulled furniture and put it in storage to allow the 6-foot distancing rules. We did shut down a lot of the open areas, the common areas where students were to gather. We took the chairs and stuff out of those areas so students wouldn't go there and gather and that kind of stuff. So it made the campus a little more sterile, if you want to say that, because you don't have that gathering areas outside the classrooms and everything that we had before. But we hope those will return in the future. But just filling up a warehouse full of furniture and bought lots of plexiglass. And we were fortunate. We had a company that donated a whole bunch of cubicles, and we used a lot of the walling from that cubicle to create separation spaces where we needed to have separation spaces. And that allowed us to mix those walls that are designed to be portable with plexiglass attachments to give windows through it, but keep a separation going. And that worked out very, very well to create those separation spaces.
That's great. I figured as much. I mean, any of us that have been in a doctor's office or any public place right now, you walk in and it is like a bowling alley, let's face it. So I think just removing the opportunity for a gathering, even Starbucks, right? The tables are no longer there when you're able to walk into some restaurants. So I think, just to reiterate, just kind of following all of those guidelines that the federal government has kind of put out there, and then your state and local government as well. I think the next place we want to kind of delve into, and obviously because it's at the heart of this discussion today is how we've managed our financial aid, right? So Bridget, that's pretty much your area in terms of helping us maybe walk through the CARES Act and some of the new money that's coming up. And because I know folks have questions about it, so I want to make sure we leave a few minutes for the panel as well as for our guests today to ask some questions specifically. So maybe we can hear from Bridget a little bit about the two acts that are out there now for monies for our students. Thank you.
Sure, I'd be happy to do a quick overview. This past January, the Department of Education announced a second round of emergency relief funding with a very long name, Coronavirus Response and Relief Supplemental Appropriation Act, or abbreviated as the CRRSAA, or more friendly known as the HERF 2. So it's there's two different acts, right? There was the CARES Act, which was HERF 1 that came out last spring, and then there's the CRRSAA, which is HERF 2. And there's a potential of a third that will be coming, potentially announced in the next month or so, is what we're hearing. This slide just kind of gives you a high-level overview of what HERF 2 is about. Thankfully, if you received money for HERF 1, you didn't need to reapply. So I know everybody loved figuring out how that GAIN system and the grants.gov site worked the first time around. So thankfully, they saved us that trouble this time if you had received funding before. And there were a few changes, I think, that helped students. The first being that you could award it to online students. I think that was a big deal. A lot of schools had 100% online students before they weren't able to award. It's supposed to go to your students with greatest need, but that really wasn't defined this time around, other than saying you should consider students who are Pell eligible. But yet it's still not required to fill out a FAFSA, although most schools that we've spoke with, and both ones we service and ones outside of the network, are using the FAFSA just because it's the easiest way to attribute where a student might have need and if they meet all the necessary criteria. It also, though, I think another big win this time is you could apply it to a student's balance if the student approved it. You couldn't force them to, they had to have a choice, but you could use it to apply for balances as well. And I know a lot of schools liked that opening up to give the students the opportunity for that too, especially if they had monthly payments they were missing. The big thing I want to stress here, because we've seen a few emails from Ed about it most recently, is that you have to spend some of the funds, some of them, not all of it, within 90 days of receiving your eligibility amount. And they suggest, unlike last time, that you only draw as you need it and as you spend it. So don't draw your whole $100,000 if that's what you received at one time. Draw it as you spend it and allocate it out to your students. Because they have made mention that if you bring all of it down at once, you better be able to prove that you spent it all at once, or it could be a red flag when it comes to reporting. Since March of last year, we've been sending out periodic updates to all of our client schools, providing some additional guidance and clarification on some of the Department of Ed information, with including ideas on how to spend it, or providing guidance on some of the schools that decided to use different forms or applications. I want to point out that the department does have two separate websites that are really good with information on both sets of funding. It provides general information, reporting requirements, FAQs, but I know it's a lot. And those two sites can sometimes be very overwhelming and not really the easiest to understand. And so we certainly offer up ourselves for any questions that you may have. Can I use this? Can I do this? What about this? I'm happy to go through and provide you what our understanding is on the requirements and the regulations, and provide some guidance to help give you a little bit of comfort of these different types of fund sources and availability that are out there. I know it's a lot and it's different. It's technically not Title IV funding, so it doesn't count as estimated financial aid. But just because it came from the Department of Education, we have tried to stay very involved and very informed on the two different resources that are out there and the opportunity and eligibility for spending them. So I just wanted to give a quick high-level overview, and then if there's any specific questions, I think we still have a few minutes. and we can answer those. Or again, you're welcome to send this to us at any point. So just wanted the opportunity to raise it.
Bridget, one of the interesting things out of that second piece that I was really appreciative, or we were really appreciative, is that it did open up to the adult student market. I think that the first round was kind of, afraid of the for-profit world and that they would garner funds from that. But the reality, as we observed it, is that adult student, which is a large chunk of our population as well, and they are severely impacted well beyond even some of our trad students too, and many of them are Pell students. So I mean, we have almost as many Pell students in that category as we do in our trad space. So I thought that was a good add to the space, and the ability, we also, it's all about the drawdown, right? So basically it's a reimbursement model. Is you have to put your own cash out there and then get the reimbursement back. And
I think, and most, correct me if I'm wrong, Eric, but most of the time the funds were coming relatively quickly when you wanted to draw them out of the G5. It was there. It wasn't like there was a delay. You just need to have your documentation of how you spent it.
Yeah, for the first round, it was pretty quick to draw down. This time, I think we've already done a pretty large tranche out to our students, and we're waiting on those funds to be available. But we know that that'll be coming soon. So fortunate, and we're happy to be in a position to be able to have the funds coming from the government to help us to pass through to the students, and then also as an institution to help recoup some of those losses so that the business unit of education can continue in this new model.
Yeah, and when you mentioned loss, I know just as a highlight, I think most have read that by now, that you could use it to pay for payroll expenses as well, I think, which helps some of the schools too, I know, during this crisis.
Dr. Wagner, did you have anything to add or any questions based on what we just discussed?
Yeah, we are in the process right now of evaluating what we're going to draw down and how we're going to do the HERF 2. We're still reviewing that and trying to put a timetable out there on what we're going to do and how we're going to spend the money. The first round, we were the lowest funded public college in South Carolina because of the way they divvied it up by student. We had done a lot of work after the hurricane, and so the impact by the government standards was low cost to us, so we got not very much money. So a lot of the things we did, we paid up front, and now we're going back to see if some of those expenses we did will be reimbursable toward the HERF 2, or do we just have to just plan on different things to spend it on, or maybe we can't go back and recoup the money that we spent already, but maybe it'll pay for it moving forward in the situation that we are in now. So it's kind of, because our enrollment didn't dip and we've actually increased enrollment, it didn't affect us that much on the payroll side or the operations side. It was the new things we put in that we didn't budget for that we're using, which is totally what I think the intent of the funding is for, is the real change you had to do at your college to make this transition. And that's what we're doing now, is going in and saying, okay, this activity, would we have done it or not done it? And if we wouldn't have done it because of COVID, then is an acceptable charge. And that's kind of the avenue.
I like the way I like that thought process.
And that's we're really picky on it, because
we actually have a COVID code.
Yeah, we do. when we spend the money, we put it into the COVA. We actually set up a budget line in our budget that way, and we put it there. But now we're reevaluating that and going back and saying, is this something that definitely 100% is COVID? And we wouldn't have done this unless COVID hit. And there's some things that we did that COVID accelerated it, and we were going to do it anyway, and we just did it faster than we normally would have done it. Like some of the perimeter fencing we put into college to limit our access. We were a very open campus. You could walk in from any direction, any parking lot. Now we have very restricted area, and we had to do a lot of chain link fencing to do that. Well, we were going to do that anyway, so we didn't feel that was something that we should have charged against the COVID-19 CARES money, so we took that out. So those are the kind of examples that we're going back now, even though we spent the money in reaction to the event. Maybe it's something that we would have done anyway, and so therefore we're not going to charge it. We just accelerated the process.
I think while you were, there's some feedback. While we were chatting, there was a question, and it was, have we experienced or have any of the schools experienced turnover in the financial aid area as a result of COVID? And I can speak to some of the other clients. I think your two offices, probably not so much, but with some of our other clients, yes, that was the case.
But for us, we did accelerate some of our financial aid projects, though, particularly with you all, as we look at to knowing that we have even our traditional students likely are not going to be coming back to a walk-up service model in the future. How do we automate better? How do we leverage our system better? How do we communicate more effectively? Even 1-minute surveys for customer experience, right? So we can try to realize that traditional, the timeliness of our response, but then the automation is becoming a bigger play for us, which I think again is an outcropping of probably accelerated that because of COVID needs, and then the future students will benefit from that work, and particularly our partnership with FA Solutions.
Yeah, I would think, and one thing we haven't talked about is dual enrollment. We have quite a large population of dual enrollment, and because we have the experimental Pell for dual enrollment, we did see a dip in our financial aid applications for dual enrollment. And that was because we couldn't do that hands-on parent meetings that we were having before COVID to get the student engaged with the financial process of financial aid while they're in the high schools. And so now we're going back now and trying to have those meetings now that we're a little more opened up. And that now we actually can go back into the high schools and the students are back in the high schools, we can actually now start having those conversations where we couldn't do that in the fall. And so that was one thing that we're looking at. And then the other thing that we're looking at now, going out of COVID, is how do we streamline our financial aid services to keep up with our enrollment? Because we got so efficient and of getting students to stay in the classes and to continue with the retention and the persistence. And then our outreach of finding pockets of students and getting them engaged with the college became so efficient that now it's flooding our financial aid office now with Pell and getting the applications processed and all that. So we're doing a deep dive right now into our financial aid processes, and we've changed them a couple times with the help of FA Solutions, but now it's time to go back in again and do another adjustment because of the growth. And we're expecting to end the year up. In the last 4 years, we went from 850 students to 2,100 last year, and we're looking at being at 2,400 this year. So even coming out of COVID, and we think it's going to start dominoing now after COVID, and we'll see jumps of not 15%, but 30 and 40% coming out of COVID. So we're really trying to look at how do we speed up those processes and our communication in those areas, especially with the dual enrollment.
That's impressive. I just, in the essence of time this afternoon, I want to be respectful of the folks that have joined, and I certainly want to thank both of you for taking an hour of your afternoon to spend with us, sharing such great information. We are very grateful for your partnership with both of your institutions, your staff, and again, just really grateful for the time for everybody spent with us for this last hour. If you have any additional questions that we didn't get to, or you are interested in trying to connect with us offline, certainly feel free to jot down the phone number and the email address, and we'll be happy to reach back out. I'm happy to contact anybody. Frankly, it's usually myself or Bridget. So we'll be happy to answer any questions that you might have. But again, can't thank you both enough for spending an hour with us and sharing these really extraordinary things that we did during COVID, right?
Well, thank you.
Yeah, it was a pleasure. So again, everyone have a great afternoon, and thank you. We look forward to the next one.
Have a wonderful day.
Bye. Thank you.